previous videos, and welcome if you're watching this for the first time. Essentially, our scope of discussion today will be about the posterior triangle. Now, I had said that I will be trying to cover the posterior triangle in my previous lecture, or rather in my previous discussion itself. But in my previous discussion, since we discussed about the sternocleidomastoid, which is the key muscle of the neck, and it took out like most of our time, so I think it's only fair that we discuss posterior triangle now in a separate discussion. So, um, as all of us, we already know this, and I've said this many times, that sternocleidomastoid is a key muscle of the neck, and it is dividing each side of the neck into two triangles. Okay, these two triangles are the anterior triangle, which is obviously, as its namesake, located anteriorly, and the posterior triangle, which is obviously located posteriorly. So, our scope of discussion today is not about the anterior triangle, rather it is about the posterior triangle. So go ahead and see if you can locate where the posterior triangle is. It is very clear it is. Yes, this over here is the posterior triangle. Kindly note the mouse pointer. Yes, so that is the posterior triangle. So let's first talk about the boundaries of the posterior triangle, right? Right. As we can all very well appreciate, the posterior triangle is bounded anteriorly. I hope everybody has a sense of direction here. This side is the anterior side, right? This side is the posterior side, right? No problem with that. So posterior triangle is bound anteriorly by what muscle is this? Yes, sternocleidomastoid. But to be more precise, it is bound by the posterior border of sternocleidomastoid, right? So that is the anterior boundary of posterior triangle. Whereas the posterior boundary of the posterior triangle is this. What is this? What is this muscle? This extensive muscle? Yes, this is another important muscle of the neck, the trapezius muscle. And this over here is the anterior boundary of the trapezius muscle. So the posterior triangle's posterior border is none other than the anterior border of trapezius muscle. Yes, very, very important. Okay, okay. And as we can all see, their apex is the point where these two muscles or these two boundaries kind of meet, right? So when we will be talking about the occipital bone, there we will talk about the superior nuchal line and its attachments. There we will see that trapezius and sternocleidomastoid both have their attachments to the superior nuchal line. We already saw to the insertion of sternocleidomastoid in the previous discussion. So there we will see that these two muscles have their insertions very close to each other on the superior nuchal line itself. And that essentially marks as the apex of the posterior triangle. I hope I'm being clear here. Okay? Okay. Moving on. What is the base of the posterior triangle? Yes, pretty self-explanatory. The clavicle. But obviously, we have to be a little bit more precise. So, superior surface, obviously, superior surface of the middle third of the clavicle. See, this is roughly the middle part of the clavicle, right? So, superior surface of the middle third of the clavicle acts as the base of the posterior triangle. Okay? Okay. Now let's talk about, so we talked about the boundaries as such. Now there are two more things that we need to talk about. One of that thing is the roof of posterior triangle, and the other is the floor of the posterior triangle. So think about it as kind of a three-dimensional room, as a three-dimensional room. So a room, it has a roof, which will be something which will be covering the posterior triangle. You might say superficially, and there will be a roof and a floor, which will be essentially the deeper aspect of the posterior triangle. So let's go with the roof first. So roof of the posterior triangle is formed by, mark my words, the investing layer of deep cervical fascia. Very, very important. I think I never actually discussed about the deep cervical fascia and its three layers in my previous discussions. I should have made that video because that is a part of the superficial structures of the neck, which we have already covered. So I think that that discussion will be coming out very soon. I actually really forgot, so I really apologize for that. I'm really sorry. But essentially, the deep cervical fascia, it has three layers, and the first of that layer is known as the investing layer of the deep cervical fascia. Okay, that investing layer of deep cervical fascia is essentially what is constituting the roof. And what is the roof of posterior triangle? Like, what do I mean by that? The roof of the posterior triangle, by that I mean a superficial structure which is covering the posterior triangle superficially. Posterior triangle is a space, right? It's a space. So obviously there has to be something which is superficially covering up this hollowed out space, right? And there will also be something which is forming the base of this space, deeper structures which will be forming the base of this space, right? The superficial structure which is forming, which is covering this space, that is the roof, and the deeper structures which is actually essentially constituting its base, that is the floor. Okay, so that's the concept of roof and floor. So obviously roof will be something which is superficial, and hence the investing layer of deep cervical fascia is acting as the roof. Okay, and this investing layer of deep cervical fascia, obviously it is stretching between the sternocleidomastoid over here and the trapezius over here, and it covers those muscles as well. We will see to that in our subsequent discussion. So is the concept of roof and what constitutes the roof of the posterior triangle clear? Right, thank you very much. Now let's move on to the floor of the posterior triangle. This is where real anatomical knowledge comes into play, and a little bit of, I would say, memorization comes into play. You see, it is very self-explanatory. Like, I did not bring the superficial structures, I did not bring on the deep cervical fascia to show you what constitutes the roof of posterior triangle, because I think that it is pretty self-explanatory. That is why I did not turn on the connective tissue here and show you the actual fascia. You already know that it will be covering it, right? But here, in case of the floor, I must show you what constitutes the floor individually. The floor of the posterior triangle is constituted by muscles. Yes. Okay, so it is a muscular floor. Hence, what are the muscles is an important knowledge, right? It's an important knowledge to know about. Now, see, these are the muscles. Can you see? This is the posterior triangle, right? And can you see that there are muscles which are deeper to the posterior triangle, in between the posterior triangle, in the posterior triangle, but deeper to it? These are the constituents of the floor of the posterior triangle. Okay, okay. Now, what are they? So let's start with the first muscle. This over here, this is the first muscle. See, because as you can see, this is the demarcation of trapezius. See, this is trapezius, and this fine line is the demarcation of trapezius. So trapezius ends with this line. Next to this is a small part of a muscle. We can see that this, over which my mouse pointer is right now. This is what we call to be the semispinalis capitis. See, the semispinalis capitis muscle. So that is the first muscle. So we will go from top to bottom, okay, and hence keep naming the muscles. So the first muscle from top to bottom, constituting the floor of the posterior triangle, is semispinalis capitis. Done. Then we have another capitis muscle. This is known as splenius capitis. Okay, this is known as the splenius capitis. If since we are actually studying neck for the first time, this anatomical region is new to us, so probably these muscles will be unknown. The names of these muscles will be unknown. But then again, any anatomical region that we study for the first time, obviously the muscles are a little unknown, but then we gradually get acclimatized to them. And these muscles are very important since when we talk about occipital bone, all of their attachments are talked about, right? So I'll be releasing occipital bone very soon. I already had recorded it long time ago, never edited it out. So anyways, so this is essentially semispinalis capitis, okay? This is splenius capitis, okay? Let's come below. So this was splenius capitis, this entire thing, okay? Now, this is levator scapulae, the levator scapulae muscle, okay? Done? Done. Now, I would like to draw your attention to the next muscle. See, the next muscle will be, if you can see carefully, this over here, this is the scalenus medius muscle. But this over here, this is the scalenus posterior muscle. And this over here is the scalenus anterior muscle, right? So these are the three muscles of the scalenus group, right? Scalenus anterior over here, medius over here, and posterior over here. Now, not all three of them are the constituents of floor of the posterior triangle. Rather, only scalenus medius is the constituent of the floor of posterior triangle. Okay. Now, sometimes what happens is, there is another muscle which is not given over here, since it is not essentially a muscle of the neck region. But sometimes the uppermost digitation of that muscle may fall under the floor of posterior triangle. Okay, and that muscle is none other than serratus anterior. Yes, serratus anterior is a, you might say, thoracic muscle, a lateral thoracic muscle, right? It is attached along the thorax in the lateral rib cage. But the upper digitation, the first digitation of serratus anterior, it extends so superior that it might even reach the posterior triangle's floor, and hence sometimes the first digitation of serratus anterior is also considered under constituent of the floor of the posterior triangle. Now, these are the muscles which constitute the floor of the posterior triangle. So how do you remember this? This is the worst thing, remembering. And so I tried to come up with a mnemonic. I tried to, And I did come up with one, but it is not, I would say, very like an amazing mnemonic, I wouldn't say, but I think it gets my job done at least. Okay? Okay. So the mnemonic is something like, um, the cape, same cape of Shay Cormac was lost when he was scaling sandy dunes. Okay, I know the mnemonic is a little, um, I would say, not a very common one. But then again, these muscles are not also very common. So here is the thing: the same cape, cape, like the superheroes, they have capes behind their back. Batman, Superman, they have capes, right? The same cape of Shay Cormac. Shay Cormac is the name of someone. Now, people who are gamers, I keep bringing in gaming references because I really am into gaming. So, anyways, Shay Cormac is the protagonist of a game known as Assassin's Creed Rogue. So, he's a pretty, I would say, unique character. So, anyways, and he has a unique name also, Shay Cormac. Shay Shay. Cormac is Cormac. Cormac. The same cape of Shay Cormac was lost when he was scaling, as in scaling means climbing, scaling the sandy dunes. Dunes, sandy dunes, we all know that, right? Right. So, what do they stand for? Okay, I think this mnemonic should get your job done for remembering the floor constituents. So same cape. Why did I include same? So that you can recognize same as in semispinalis, cape as in capitis. You get it? Same cape, semispinalis capitis. So it's pretty effective if you can remember it, I think. Of Shay Cormac. See, semispinalis capitis is also SC abbreviated, and splenius capitis, which is the next one, that is also SC abbreviated. So how will you remember if semispinalis capitis is the first one from top to bottom, or is splenius capitis the first one from top to bottom? So that's why I went with the same cape first. Same cape is the first thing to be said. So semispinalis capitis is the first muscle. Shay Cormac, SC again, but this time we know what the SC will stand for. Splenius capitis. Okay, splenius capitis. Done. Same cape of Shay Cormac was lost. LS, lost. Levator scapulae. Okay, was lost when he was scaling as in scalinus medius. The medius part, I just remember that one, that there is medius is the middle one, so medius, yeah. Scaling sandy dunes. Sandy, SA, serratus anterior. Dune, I actually introduced that to remind me that dune stands for digitation. So first digitation of serratus anterior. So semispinalis capitis, splenius capitis, levator scapulae, right? Then we will have scalinus medius, and then sometimes we have first digitation of serratus anterior. These are essentially what constitute the floor of the posterior triangle. Okay, so you may choose to remember the mnemonic that I provided you, or you may come up with one of your own. That is amazing. Good luck with that. Or you may just remember it the old-fashioned way. right? So, anyways, having talked about the floor of the posterior triangle, let's now talk about another very important aspect. See, now we are talking about the floor, right? Since we are talking about the floor of the posterior triangle and the different muscles which constitute the floor of the posterior triangle, um, these muscles, they are essentially also covered by the deep cervical fascia. Okay, okay. But now try and remember what I said initially. I said deep cervical fascia has 3 layers, right? I said that the first layer is obviously the investing layer. And the investing layer of deep cervical fascia forms the roof of the posterior triangle. There is absolutely no doubt in that. However, what about the floor of the posterior triangle? The floor is constituted by those muscles which I talked about. But these muscles which constitute the floor, they are also covered by the deep cervical fascia. But then the question arises as to which layer of the deep cervical fascia? See, the answer to that question can obviously not be investing layer, because investing layer is more superficial and investing layer is already forming the roof of the posterior triangle. So the first layer cannot be the answer. What is the second layer of the deep cervical fascia? The second layer is what we say to be the pre-vertebral layer of deep cervical fascia. That is the second layer. So the pre-vertebral layer of deep cervical fascia covers these muscles constituting the muscular floor of posterior triangle. And since this is a fascia which is covering all these muscles together, so together this covering, this facial or fascial, I don't know, still know the pronunciation, this facial covering of the muscular floor of the posterior triangle is known as the facial carpet, as if a carpet has been laid off. The facial carpet. So the facial carpet of the posterior triangle is essentially the prevertebral layer of deep cervical fascia, which is covering the muscles constituting the muscular floor of the posterior triangle. Okay. Okay. By the way, this prevertebral layer, it will also go on to form the axillary sheath around subclavian artery. It will also form the brachial plexus sheath. Right. We'll see to all that in our discussion of the deep cervical fascia. Okay. Okay. Now, why I talked about this facial carpet, that we will see on the clinical relevance of, or the clinical aspects onto the posterior triangle. We'll see there. Okay. Okay. Now let's come to a very, very important thing. Okay, listen to me very carefully. So the posterior triangle, if I give you this view, this entire view of the posterior triangle, this is essentially the posterior triangle, no problem in demarcating that. Can you all appreciate the fact that this tendon, this muscle, this is kind of moving horizontally, right? Somewhere close to the base of the posterior triangle, this muscle. So what this muscle is doing, this very specific muscle is doing, is it is dividing the posterior triangle into 2 more triangles. The upper part, or the upper triangle, and the lower triangle. See? Right? So this horizontal muscle, which is running horizontally rather, this is what we say to be the inferior belly of omohyoid muscle. Very, very important. The inferior belly of omohyoid muscle is essentially running horizontally across the posterior triangle close to its base, essentially dividing the posterior triangle into an upper triangle and a lower triangle. Okay. Okay. Now this upper triangle, this is known as the occipital triangle. Very important, the occipital triangle. Whereas the lower triangle is known as the subclavian triangle, or also known as the supraclavicular triangle. Okay, so this one, this smaller triangle, right? This is known as the subclavian triangle or the supraclavicular triangle, and the upper one is known as the occipital triangle. Okay. Okay. So this is an extremely important concept, and this is very important and worth remembering. Okay, done. Now we move on to the, I would say, more grim aspects of the posterior triangle, and that is the contents of the posterior triangle. This is where things get a little, I would say, on the difficult side, because the contents of posterior triangle, I wouldn't say they are huge, the large number of contents. Only a few things are very important, and if remembered, then it's okay. So yeah, let's get on with it. Okay, so now having the overall picture and the different things, now we can now talk about the contents of the posterior triangle. And let's talk about the contents as divided within the two triangles, that is occipital triangle and the subclavian triangle. So we first talk about the contents of the occipital triangle, right? Right. The most important content in the occipital triangle is undoubtedly the spinal accessory nerve. So this over here is the spinal accessory nerve. See? So since we are talking about the spinal accessory nerve, I hope it's visible over here, the one shaded in violet over here, right? So since we are talking about the spinal accessory nerve, let's quickly talk about how it is running, right? So how it runs is essentially, the spinal accessory nerve is obviously, is the 11th cranial nerve. So if it's a cranial nerve, so obviously it's coming down from the brain. So it's coming down, and it's a little difficult to show here because of the very strong crowding present. Like a lot of things are crowded together here, so it's difficult to show here. But the spinal accessory nerve, essentially, it is related to the atlas, which is the first vertebra. So spinal accessory nerve will come down from the brain in front of the transverse process of the atlas. Atlas is the first vertebra of the vertebral column. Okay. After that, what it will do is, I have removed the sternocleidomastoid here. But if we bring the sternocleidomastoid back, so having now we have brought back the sternocleidomastoid. So, and this over here, oh, sorry for that, sorry for that. This over here, this is the spinal accessory nerve. So, see what's happening here is, if I fade this, if I fade the sternocleidomastoid, fade it. See, this over here is the spinal accessory nerve. See, we can see the course of the spinal accessory nerve through the sternocleidomastoid because we have faded it out. So after essentially running in front of the transverse process of atlas vertebra, what the spinal accessory nerve will do is it will run down and lateral. We can all appreciate that, right? It is running down and lateral, and it will essentially pierce the anterior border of sternocleidomastoid. The sternocleidomastoid is this over here, okay? So it is essentially coming through the sternocleidomastoid. I'm sorry again. Yeah. So it is essentially coming through the sternocleidomastoid. It will actually pierce the anterior border of sternocleidomastoid. It will actually supply the sternocleidomastoid. If you remember the nerve supply of sternocleidomastoid, you will remember the spinal accessory nerve supplies it, right? And then, amazingly enough, it will emerge out through here from the posterior border of the sternocleidomastoid. It will emerge out, run through the posterior triangle. Here it will run through the posterior triangle, and then it will disappear behind the anterior border of trapezius. Okay, so that is essentially the course of the spinal accessory nerve as far as the posterior triangle is concerned. Okay, so it will run down in front of the transverse process of the atlas, pierce the anterior border of sternocleidomastoid, supply it, emerge out through the posterior border over here, run down and laterally throughout its course, run through the posterior triangle, then it will disappear behind the anterior boundary of trapezius. So that's the course of the sternocleidomastoid in the posterior triangle. Okay. Okay. Another amazing thing which is very, very clear and obvious here is that, see, this is the spinal accessory nerve which is selected. Can you see that the spinal accessory nerve is lying above which muscle over here? These muscle. This muscle is the levator scapulae muscle. See, right? Which I was selecting wrongly. So, see, the spinal accessory nerve and the levator scapulae muscle fibers, they are almost parallel to each other. They are almost parallel to each other. See, pretty self-explanatory. So that is another piece of information which you might choose to remember. Okay, the spinal accessory nerve, it runs parallel to the levator scapulae. Okay. Okay. And in fact, it's not given over here. Rather, it might be given over here. I have not turned the lymphatic system on in this model. But essentially, the sternocleidomastoid in the posterior triangle, after emerging from the posterior boundary of the sternocleidomastoid, over here, it is related to some lymph nodes. Okay, it is related to some lymph nodes. Done. Done. Now, another thing let me talk about. That is this sternocleidomastoid, not sternocleidomastoid, the spinal accessory nerve. The spinal accessory nerve, do you remember that I said that this fascial carpet, I talked about the fascial carpet, right? And I also talked about the roof of the posterior triangle. So the roof of the posterior triangle, the the spinal accessory nerve, sorry, I keep messing that up. The spinal accessory nerve is essentially adherent, it is essentially adherent to the deeper aspect of the roof of posterior triangle. All right, so it is not deep to the floor, it is superficial to the floor, but it is deep to the roof of the posterior triangle. In fact, it is adherent to the deeper aspect of the roof of the posterior triangle. Okay. Okay. Now, let's talk about that's one content. And don't worry, the other contents will not be as exhaustive as this. This was the only one which we needed to know a little well. So, having talked of spinal accessory nerve, which is one of the major constituents, or yeah, constituents of the occipital triangle, let's talk about the other four nerves. Do you remember the four cutaneous nerves of the cervical plexus, which I had talked about? There were four cutaneous nerves given by Lord Gallien's tech is super cool. Lord Gallien's tech is super cool. LO is lesser occipital. Gallian GA is great auricular. TECH, TECH, abbreviated as TC, that is transverse cervical. Super cool, SC, supraclavicular. So these four cutaneous nerves of the cervical plexus, they are also constituents of the occipital triangle. So let's find them out. So I had to remove the sternocleidomastoid again, but we will bring it back. Okay. Okay. So as we can all see, it's quite the mess here, and it is messy because I have turned on all the levels of nervous system here. This is layer 5. So all the nerves almost are present. Superficial, deep, everything, and all the branches are also given. That is why it's looking very messy. So we need to actually now locate the nerves, right? The superficial nerves. The first one is obviously lower occipital. So lower occipital, we already know where to look for it, right? This is the occipital region. So obviously this is the lower occipital nerve. Let's confirm it over here. And yes, this is the lesser occipital. Sorry for that. Lord Gerald, LO is lesser occipital and then great auricular. I'm very sorry. It's not lower occipital. My bad, my bad. I keep messing up things like these. Deepest apologies. So lesser occipital. Okay. So that is the lesser occipital cutaneous nerve. So this is coming from the posterior triangle, right? So this is a constituent of the posterior triangle. We can all vouch for that one. And it is also a constituent of the occipital triangle. We can also vouch for that one, right? So the lesser occipital, an important thing about the lesser occipital is that, see, this over here is the spinal accessory nerve, right? This is the spinal accessory nerve. And this over here is the, oh, sorry for that again. This over here is the lesser occipital. So you can see that the lesser occipital and the spinal accessory nerve, they have kind of a hooking up relationship. So what we say is that the lesser occipital nerve hooks up, or rather hooks around. It is hooking around, right? See, it is hooking around this nerve, which is spinal accessory nerve, and then it is going up. It is going up. Okay, so it hooks around the spinal accessory nerve and ascends up, right? And the parts which it actually innervates. Now these are bland details. These are bland details, but they do have some logic behind them. Like obviously, lesser occipital, you would think that it innervates the area around the occipital region, right? Because its name suggests that. So lesser occipital, this nerve is actually supplying the skin. Obviously, it's a cutaneous nerve, so it supplies the skin of the cranial surface of auricle, the auricular region, the cranial surface of the auricle, and the head behind auricle. We can all vouch for that. Like, these are bland details. You can just go through the textbook. It's I could not bring myself to really get interested in these. Anyways, so that's the lesser occipital nerve. Then, almost parallel to it, you can already see we have another nerve. And how do we know that that is the great auricular? Because it is going around to the auricular region over here. See, the auricular region. So this has got to be the great auricular nerve, and it is, see, emerging parallel to the lesser occipital nerve, right? And again it is ascending up, right? Now it is supplying the skin of the face over kind of the angle of mandible, although this is not really very prominent here, but that's, I'm just quoting the textbook here. And the skin over the mastoid region, yeah, we can kind of vouch for that, skin over the mastoid region. And yeah, lower part of the auricle, that also we can vouch for, right, the auricular region. So these are just bland details, done. So second cutaneous nerve also done. Now let's move on to the third one. Third one is obviously the transverse cervical. So how do we locate the transverse cervical? So transverse and cervical, these are the two words that you should look for. What nerve here is transverse and it is going to the cervical region? This one over here, this one. Let's see if this is the transverse cervical nerve. And yes, it is. Voila. I get very confused with this, like which one is which one. But this is the transverse cervical, and it's pretty logical also. See, transversely going, cervical also, and it is the most superficial. This over here is also transversely going and cervical, but it is a deeper branch of a deeper nerve. But this was the most superficial nerve, which is transversely going and cervical also, in the cervical region also. So that is why this is the cervical, or rather transverse cervical. And see, they're all coming out from that region. They're all kind of coming out from that region, because if we extend this part, we'll see that this here is the anterior ramus of the second cervical nerve. The anterior, so it is the rami of the of C2, right? So they're all coming out from there according to their root values, using a little bit of logic, right? And transverse cervical, so obviously it will actually supply your skin over the neck region and in front of the neck region, right? So that is why it is transverse cervical. In front of the neck region, it will supply the skin, kind of. Okay. So that's transverse cervical nerve for you. And the last nerve which remains is the supraclavicular. Now, supraclavicular nerve is not just one nerve, it's a group of three nerves. So there are three supraclavicular nerves. So we have to look for a group of three nerves. So let's try to find them out, shall we? So this over here looks promising, and that is the lateral supraclavicular nerve. So if that is the lateral one, this has got to be the intermediate one. So this is the intermediate supraclavicular nerve, and this, I'm sorry, this over here is the medial supraclavicular nerve. So the lateral, medial, lateral, intermediate or middle, intermediate or middle, and the medial supraclavicular nerves. Okay. Now each one of them will have their own areas of innervation, but essentially the the supraclavicular nerve, it supplies the skin over supraclavicular region, so kind of the chest region, the shoulder region, right? Those regions you can vouch for supraclavicular nerves innervating those regions. Okay, okay. See, they're actually, yeah. That's why they are supraclavicular. Another thing, this is the, what did I say? Is the middle or the, yeah, intermediate supraclavicular nerve. If you remember, when we talked about the clavicle, I said that one of the peculiarities of clavicle is that it is sometimes pierced by a nerve. What nerve was that? This nerve, the middle or intermediate supraclavicular nerve, which is a branch of the supraclavicular nerve itself. Like it constitutes, it's one of the supraclavicular nerves, right? Right. So these are the four cutaneous nerves of the cervical plexus. All of them are constituents of the occipital triangle or the posterior triangle as well. Okay. Okay. Now, what are the root values of these four nerves? That is also pretty easy. So I remember them as C2, C2, C3, C2, C3, C3, C4. Four root values. First one is C2. So lesser occipital is C2. Next one is C2, C3. Great auricular is C2, C3. Okay. The next one is again C2, C3. So transverse cervical is C2, C3 again. And the last one is C3, C4. So supraclavicular is C3, C4. That's the root value. Okay. So that's about the different nerves being constituents of the posterior triangle. Now, if I bring the sternocleidomastoid back, I'm going to explain a very important clinical aspect. So we are intertwining the clinical aspect with the contents here. So let me bring the sternocleidomastoid muscle back. So, as you can all see, I have brought back the sternocleidomastoid. But look here. Look at this very special point over here. Okay. See, although they have shown that the lesser occipital and the great auricular nerves, they are emerging out pretty above this point, but we can all kind of say that, you know, this point is probably the point, this point here. This point is very roughly speaking the point from where all these nerves are emerging out of, right? The spinal accessory nerve emerges out from this point. Almost the four cutaneous nerves of the cervical plexus, all of them are emerging out from this point. And what is this point? This point is almost, we can say, the junction between the upper 1/3 and the middle 1/3 of the sternocleidomastoid, somewhere located near the middle of the sternocleidomastoid muscle, and obviously the posterior border of the sternocleidomastoid muscle. Although here the lesser occipital and the great auricular nerves have been shown to be emerging a little above this point, I need to see to this a little bit, but we can, for all intents and purposes, we can kind of consider that this point is from where they are emerging out of the sternocleidomastoid's posterior border. We can all consider that this is the point, and this is the point, is the meeting point of the upper 1/3 and the middle 1/3 of the posterior border of sternocleidomastoid. This point from where all of these nerves are coming out is known as the nerve point of the neck. The nerve point of the neck. Very important thing, because, and why it's clinically important is, in case of cervical plexus nerve block, when an anesthetic agent is injected into a nerve plexus to essentially block sensations of the nerve of that plexus or in that region, local anesthesia. So when that is done for the cervical plexus, we say that it is the cervical. So in case of cervical plexus nerve block, the anesthesiologist, he or she will inject the anesthetic agent at the nerve point of the neck, which is essentially this over here, right? So that's a very important knowledge that we should all have. Okay. Okay. Now, what are the other contents of the we can say posterior triangle? So posterior triangle, or rather the occipital triangle, we are talking about that first. It also has other nerve contents and it also has certain arterial contents. Let's first talk about the nerve contents. So we already talked about the spinal accessory nerve. We already talked about the 4 cutaneous branches of the cervical plexus. Now, there is another nerve which is a part of the occipital triangle, and that is the dorsal scapular nerve. So let's find out the dorsal scapular nerve. Okay, so after a lot of searching, I was able to finally pin down the dorsal scapular nerve as indicated by the purple nerve over here. So as you can all see that it is above the inferior omohyoid, so it is a part of the or constituent of the um, occipital triangle. So the dorsal scapular nerve, it, if you remember the brachial plexus, then you will remember that there were two nerves which kind of emerged from the roots of the brachial plexus itself. One of them was dorsal scapular nerve, which emerged out from the C5 root, so its root value is C5 only. And the other was long thoracic nerve, which emerged out from the C5, C6, and C7 roots, and hence its root value is C5, C6, C7. But the long thoracic nerve is not a part of the cervical, or you may say that it is not a part of the occipital triangle or the posterior triangle as at large, because it moves down to the thoracic region, right, to kind of supply the serratus anterior muscle. So anyways, the dorsal scapular nerve, on the other hand, it remains in this region and it kind of moves on through the occipital triangle like this, and it will go down to the scapular region. Okay, so that's the dorsal scapular nerve, and it is one of the constituents of the occipital triangle, right? Right. Now, let's talk about since we have talked about the nerves being constituents, let's now talk about the arteries which are part of the or constituents of the occipital triangle. So the arteries which constitute the occipital triangle, let's bring them out. So having talked of the constituents of the occipital triangle being the nerves, now let's talk about the arterial constituents of the occipital triangle. So as the name suggests itself, the occipital triangle, so obviously the major constituent as far as the arteries are concerned will obviously be the occipital artery. So that's why the name itself is occipital triangle, and that's another piece of information that you should know, that the occipital triangle is named so because occipital artery lies in it. Just like that the subclavian triangle is named so because the subclavian artery, or to be more precise, the third part of the subclavian artery lies in it. So anyways, the first thing that we should remember is that the occipital artery is actually a part of the occipital triangle here. So let's find the occipital artery then. So this essentially is the occipital artery, and we can see that it is coming out from over here, and this should be the external carotid artery. Yeah, so this is the external carotid artery. So the occipital artery is a branch of the external carotid artery, and we will get on to all of these when we talk about the blood supply of the head neck region specifically, but now is not the scope. So one of the constituents of the occipital triangle is the occipital artery. Done. And another constituent is thought to be the superficial transverse cervical artery. Let's find that out now. So this over here is the transverse cervical artery. Very easy to find, very easy to find out. It's going transversely and it is in the cervical region, so obviously it's the transverse cervical artery. Now the transverse cervical artery, it is obviously having two parts, the superficial part and the deep part. So the superficial transverse cervical artery is considered as a part of the occipital triangle. Okay, and it is also a part of the subclavian triangle, because as we can see it is very close to the base, so a part of the subclavian triangle as well, right? So what are the constituents of the occipital triangle? We learned about them. As far as nerves are concerned, we learned about spinal accessory nerve, which is the most important constituent. The four cutaneous nerves of the cervical plexus, we learned about them. We learned about the dorsal scapular nerve as well. And as far as the arteries are concerned, we learned about the occipital artery, the most important artery, and we also learned about the transverse cervical artery, or the superficial part of the transverse cervical artery. So these are more or less the constituents of the occipital triangle. Okay, but what about the subclavian triangle or the supraclavicular triangle? So since we already have the arterial system on, let's deal with the subclavian triangle and its constituents. So as we can all see here, this over here is the subclavian triangle, very small, considered to the occipital triangle. So as we can all see, this is the subclavian artery, and it's a part of the, or constituent of the subclavian triangle, as I mentioned. So the third part of the subclavian artery is actually a part of the subclavian or supraclavicular triangle. More on this, we'll talk about this when we talk about the constituent or the blood supply of the head neck. Okay. Now, just like the subclavian artery, the subclavian vein is also part of the subclavian triangle. Okay, subclavian vein is also a part. So let's quickly see to that. So over here, we have the external jugular vein, which by the way is also a part of, yes, the subclavian triangle. So the external jugular vein drains into the subclavian vein over here, and the subclavian vein and the terminal part, or the last part of the external jugular vein, are also parts of or constituents of the subclavian triangle. But the external jugular vein is not a part of the occipital triangle, because it is not a constituent of the occipital triangle, because external jugular vein lies superficial to the occipital triangle, more or less. It only pierces the investing layer of deep cervical fascia about 2.5 centimeters above the clavicle, and that is the part where it kind of becomes a deeper structure, and that part more or less lies in the subclavian triangle. That is why it is a part of the, or constituent of the, subclavian triangle. This is my understanding. Okay. So the subclavian vein, the terminal part of external jugular vein, are all parts. What about other arterial constituents? So let's go for that. Now you remember the dorsal scapular artery? The dorsal scapular artery, it is also considered as a part or constituent of the, what we say to be, subclavian triangle. And the reason for that is, it will be another major. Okay, so let's find the dorsal scapular artery. So remember, we talked about the dorsal scapular nerve being a constituent of the occipital triangle. Occipital triangle means dorsal scapular nerve, but in the subclavian triangle we have the dorsal scapular artery, which is a constituent. Now these are the things which really make things complicated. So let's find the dorsal scapular artery here. Actually, see, it's pretty easy. All of these dorsal scapular arteries, then we will have the suprascapular arteries, we will have the superficial transverse cervical artery, which by the way is also a part of the this occipital triangle. All of these arteries are parts of the subclavian artery. They're all branches of the subclavian artery, from either the first part, the third part, etc., etc. Right? Either direct branches or intermediate, like indirect branches. That is why there is no reason to panic that how will I remember so many random things? You don't have to remember, these are not that random. We all know that subclavian artery is a part of the subclavian triangle, right? So the branches which are coming off from the subclavian artery more or less have a tendency of becoming a part of the subclavian triangle as well. For example, let me give you an example. For example, we talked about the dorsal scapular nerve. We are talking about the transverse cervical artery. Oh, not the nerve. I'm sorry. Not dorsal scapular nerve. I made a mistake there. Don't be confused. The dorsal scapular nerve is a part of the, very good, the occipital triangle. Whereas the dorsal scapular artery is a part of the, very good, subclavian or supraclavicular triangle. So these are all parts, these are all branches from the subclavian artery. So for example, the transverse cervical artery over here, this is the transverse cervical artery. So this is essentially the transverse cervical artery. It is essentially a branch of the thyrocervical trunk, which is a part of the first part, or which is a branch from the first part of the subclavian artery. So these are, see, indirect branches from the subclavian artery, and we will learn about these all when we talk about subclavian artery later in our later discussions. So that's why transverse cervical artery, that's a part of the subclavian, you might say, although here it has been a little more superficial, but more or less we say that the transverse cervical artery is a part of the subclavian triangle. At least that's what the textbook from which I read claimed. Although in this model, it's a little more superior. So anyways, the transverse cervical artery, then we have the suprascapular artery. The suprascapular artery is a branch of the thyrocervical trunk as well, and hence it is a part of the subclavian triangle. When we talk about the blood supply, these all will be clearer. So anyways, the suprascapular artery, another thyrocervical trunk branch. Then we have the dorsal scapular artery, which is, by the way, a part of the third part of subclavian artery, which is not given over here. So we have to essentially manage with what we have here. But all of these, I promise, I know it's getting a little towards the messy side. I know this. Maybe things are getting a little unclear. I know. But all of these will be a lot clearer when we talk about blood supply. Okay, because then we will be talking about only these. And then you will be able to correlate the blood supply with the constituents of the different triangles. Okay. Now, the subclavian artery, one thing which I would like to say is that, as you can see here, this is the subclavian artery. The subclavian artery and the subclavian vein both are related to the first rib, right? But the difference is that the subclavian artery will pass behind the scalenus anterior muscle. So where is the scalenus anterior muscle? This is the scalenus anterior muscle. Very, very important piece of information. Please kindly do remember this. The scalenus anterior muscle is essentially the divider between the subclavian artery and the subclavian vein. So subclavian artery will pass behind scalenus anterior over the first rib, just like this, as you can see. This is the first rib. And the subclavian vein will pass in front of the scalenus anterior also over the first rib, as you can all see. Okay, so these are very important pieces of information which I think are worth remembering. Okay, and by the by, um, an important constituent of the subclavian triangle is also considered as the trunks of brachial plexus. Now, I am not showing them because it will be another huge thing, but we kind of should have an idea that the brachial plexus has a cervical part and it also has a non-cervical part, which is the upper limb part, right? The supex part. So the roots and trunks of brachial plexus are considered as the cervical part of the brachial plexus. Okay, so the trunks are essentially part of the more or less the subclavian triangle, whereas the roots are much more deeper structures. They're much more deeper structures, and I would even say that they might even come under the occipital triangle, although I did not see them mentioned in my textbook as constituents of the occipital triangle. So anyways, they are part of the subclavian triangle. The trunks of brachial plexus are part of the subclavian triangle. Okay, done. Now let's we have almost talked about all the the constituents, I think so. Anyways, so now I think we can safely end with the clinical part, right? Right. So the first thing, since we already have the arterial supply here, we can first talk about the pulsation of subclavian artery. So this is something that you can try out right now. We can feel for the pulsations of the subclavian artery. How we can do that is, we can press at the root of the neck, at the base of the neck, you can press, we can palpate that, where essentially near the posterior border of sternocleidomastoid. So if I bring back sternocleidomastoid, then let me remove this, hide this. Yeah, so I have brought back sternocleidomastoid yet again. So how we'll do this is, this is the posterior border of sternocleidomastoid, right? We'll feel for the posterior border of the sternocleidomastoid. We'll go for the base of the neck, and then we will press deep inside, behind the clavicle, at the posterior border of sternocleidomastoid. If we palpate that region, I hope you're getting me. Okay, it's a little difficult to demonstrate that without showing it on video, but anyways, so we actually feel for the pulse at the root of the neck, pressing behind the clavicle, right? Pressing behind the clavicle, obviously, at the posterior border of sternocleidomastoid. Here we can feel the pulsations of the subclavian artery. And essentially that is why it is so important, because another very important piece of information about the subclavian artery is that, upper limb, if there is a hemorrhage, in the upper limb, then we can essentially stop the hemorrhage of these upper limb by pressing on to the subclavian artery. A very important piece of information, might even save somebody's life there. So if we know exactly where the subclavian artery is by feeling its pulsations and having a practical knowledge about that, if there is an upper limb hemorrhage somewhere, then we can essentially stop that, because subclavian artery is the primary source of blood for the upper limb, right? So we can essentially press that region, press the subclavian artery, and essentially at least slow down the hemorrhage, right? Right. So that's that about the one of the clinical aspects. Now the second clinical aspect is, just like we can do a cervical plexus nerve block, we can also do a brachial plexus nerve block, right? Now here is a twist. Brachial plexus is essentially okay, let me, if I bring the brachial plexus up, then it will be, I think, a little clearer. So let's do that. Here we have kind of the things going on over here, and there we can see these are the trunks of the brachial plexus. This is the upper trunk, the superior trunk, this is the middle one, and that at the very farther end we can all see is the lower trunk of the brachial plexus, or the inferior trunk of the brachial plexus. So the thing is that, see, these trunks or the brachial plexus itself, it can also be blocked. But the brachial plexus is essentially the nerve supplier of the upper limb. However, the blocking of brachial plexus is done in the cervical region. Why so? Because I have already said that the cervical part of the brachial plexus is essentially the root and the trunk region of the brachial plexus. The roots and trunks of brachial plexus are constitute the cervical part of the brachial plexus. And in any case of any part of any nerve blocking principle, what is done is the nerve block is done essentially as close to the roots as possible, right? So that it can have a more branching effect, so that the entire upper limb can be anesthetized, right? That's why the cervical part of the brachial plexus is targeted for nerve block. How that is done is, this is a pretty, I would say it's not that easy, because I was watching a video and it was not at all easy. I would say it's well beyond first year scope. Maybe it will be taught in final year, yeah, in anesthesiology, sorry. So anyways, so we can kind of have an idea of where the brachial plexus lies. How? We first again search for the posterior border of sternocleidomastoid, because remember that that was the nerve point. The nerve point is related to the cervical plexus of the neck, not the brachial plexus. Remember that. I was a little confused in my first reading. Anyways, so first we feel for the posterior border of sternocleidomastoid. Then what we will do is, we will essentially somewhere near the middle of the sternocleidomastoid, at the level of the cricoid cartilage. So the cricoid cartilage will be perhaps somewhere over here. We'll have to again bring back things and we have to see how they are arranged. But we all know that cricoid cartilage is the cartilage, the neck region, right? So yeah, the voice box, all of those. So we'll look to that later when we talk about them. So essentially at the cricoid cartilage level, I don't know if I will remember this information later, but let's get on with it. So at the cricoid cartilage level, at the posterior border of the sternocleidomastoid, from that point, if we draw an imaginary line to the middle of the clavicle, okay, so at the level of the cricoid cartilage, at the point of on the posterior border of the sternocleidomastoid, from that point we are drawing an imaginary line on the to the middle of the clavicle, right? Then the part of the neck which will be inferior or medial to that imaginary line would essentially very roughly denote the cervical part of brachial plexus, and from there the brachial plexus can be blocked by an injection of the local anesthetic. Okay, so I would implore all of you to go and watch a video on how a supraclavicular nerve block is done, because I feel that this information is just given. I don't know how important this will be. Like obviously you should know the anatomy of the region, but brachial plexus nerve block is, I think from what I saw in some videos, it is much more complicated than that. So I would implore all of you to watch a video and maybe educate yourselves then. And last but not the least, we come to the lymph nodes. So there are a lot of lymph nodes, a group of lymph nodes, but the most important one I would say is the supraclavicular lymph nodes. So the supraclavicular lymph nodes Obviously, we have not demarcated them here, but the supraclavicular lymph nodes are very commonly involved in tuberculosis or Hodgkin's lymphoma. Now, these are all very serious diseases and conditions. So, Hodgkin's lymphoma, right? It's a very serious disease, and lymphoma is obviously malignant growth in the lymph nodes. Where in the lymph nodes? Very commonly in the supraclavicular lymph nodes. This leads to an enlargement in the posterior triangle of the neck. Okay, right. And by the way, this is the right part. If we come to the left part, if we remove this, although we don't have to, but actually the left supraclavicular lymph nodes, the left supraclavicular lymph nodes are known as Virchow's lymph node. Virchow's lymph nodes. So they have been given a special name because they are very commonly involved in the metastasis, that is the cancerous cells. They're very commonly involved in metastasis from, stomach cancer or testicular cancer even. That's how widespread metastasis is. Or even abdominal organs cancer. So from there, they essentially, the cancer cells are maybe circulated on through the lymph by the left supraclavicular lymph nodes. Hence, it's known as the Virchow's lymph nodes, and a very special one. We'll talk about this in details when the opportunity presents itself later. But I think for now, we have done more than enough. And with that, we come to the end of the posterior triangle discussion, or at least what we could manage in that. And in the next discussion, we'll see what we'll do. So I hope you got whatever you wanted. Like, I think I could have done better in this discussion, but anyways, I think this should fare well. Thank you very much for tuning in. Thank you very much, means a lot. And see you later.